Our hero today is named James. James lives in the state of Texas, in America. He was sitting in his dialysis chair on a Tuesday afternoon. That day he turned 67, and he'd been on dialysis for 2 years, and he knew the routine very well. After about 45 minutes, James started feeling dizzy. He told himself, "I sometimes feel this way during dialysis. It'll pass." He didn't say a single word to the nurse or the medical team. 20 minutes later, the machine started sounding an alarm. His blood pressure dropped to 70/40 and he fainted in the chair. James is alive, and thank God he's doing well. But what shocked the entire medical team was that he'd felt warning signs for a full half hour. He just didn't know that they were dangerous. I'm Dr. Osama Ibrahim, a specialist in nephrology and hemodialysis. In this video, I'll explain 7 symptoms you should never ignore while you're sitting at the dialysis machine. Signs telling you or a loved one that you must inform the nurse or medical staff immediately. Before we start, let's ask a question. Why do patients stay silent and not speak up? There's something most hemodialysis patients haven't learned from their medical team. The symptoms you feel during a dialysis session aren't always normal. I know what you're probably thinking. The medical team told me that some fatigue or shortness of breath is normal during a session, and that's true up to a certain point, but there's a big difference between expected fatigue and a danger sign your body is sending you now. The problem is that most patients are too shy to speak up. They don't want to be the annoying patient. They don't want to disrupt the work of the nurses or the doctors. And honestly, many people haven't had anyone explain which dangerous symptoms require immediate reporting to the staff. Let me be frank, hemodialysis patients whose sessions end in an ER visit aren't the ones who spoke up a lot, but rather the patients who stayed silent and waited too long with these symptoms. So we'll review the 7 symptoms, starting with the one that sends dialysis patients to the ER more than anything else. Symptom number 1, low blood pressure. Low blood pressure during hemodialysis, or what we call intradialytic hypotension, is the most common and dangerous complication. But what many don't know is that it starts well before fainting occurs. Your body gives you warning signs. You'll feel sudden dizziness, as if the room spun slightly. You might also feel a sudden heat in your face or a sudden tightness in your neck, and sometimes a strange coldness running through your body. Sudden, heavy sweating might appear, and your vision might narrow, as if someone dimmed the lights. Some patients describe this feeling as if they're being pulled inward. And here's the part that surprises people. These signs can last 10 to 20 minutes before the machine detects the drop in pressure, before anything shows up. This 10 to 20 minute window is the chance for the nurse or medical team to intervene by slowing fluid removal. They'll recline your chair to raise your blood pressure, which prevents fainting or falling, God forbid if it starts to happen. They can handle it quickly and easily. But that only happens if you speak up as soon as you feel any of the signs I've mentioned, right away. And immediately stop being polite and raise your hand or press the nurse call button and say, "I feel dizzy. Please, I need my blood pressure checked now." Symptom number 2, muscle cramps. Almost every dialysis patient experiences muscle cramping during their session, and almost every patient thinks they just have to endure it. But the truth is, no, you don't. Muscle cramping during dialysis means your body is telling you that fluid removal is too high, or that the salts and electrolytes in your body are changing dangerously. A mild cramp that comes and goes is very common and manageable, often due to increased fluid removal. But there's another type of cramp, and you must know the difference. When the cramp is so severe that you can't move your legs, that's a danger sign. When it starts in the calf and moves up to the thigh, that's a danger sign. And when you feel cramping in your hands and feet at the same time, you must stop and inform the nurse immediately. This pattern, in multiple places at once, can indicate a rapid change in salts, especially potassium. If not treated quickly, it can affect your heartbeat within minutes. What many people don't know is that the nurse or medical team can reduce the dialysis speed or adjust the solution used for the session immediately during the treatment. But that only happens if you speak up. Before we continue with the other signs, we made a special video about high potassium levels and their danger to hemodialysis patients and the forbidden foods that dialysis patients should watch out for. This video is very important because it could save your life. I recommend you watch this video. I'll leave the link in the description or in the info card appearing now. Let's continue. 3rd symptom, shortness of breath during the dialysis session, is one of the symptoms patients underestimate most, and I've heard it hundreds of times. I'm already a bit short of breath because of my kidneys. And that's true. Kidney patients often have mild shortness of breath, but there's a specific type of shortness of breath during dialysis. That is not normal at all. If you start feeling like you can't take a full breath, You inhale but can't finish it. It's not just that breathing is hard, but every inhalation feels incomplete. That's a danger sign. If you feel tightness or pressure in your upper chest along with shortness of breath, that's a danger sign. If shortness of breath appears suddenly, meaning it wasn't there 10 minutes ago and suddenly it is, that's a real emergency sign. So what could be happening? Fluids might be moving to the wrong places, including around the lungs, which is what we call pulmonary congestion. This can happen during the session if the amount of fluid removal isn't appropriate for you that day. Your morning weight, the amount of fluids you drink, changes in blood pressure medications, all of these affect the lungs during dialysis. The right thing to do here immediately is to inform the nurse right away. Don't assume the feeling will go away on its own. It probably won't go away. We've reached the halfway point of a list, and the next 4 symptoms are the ones patients report the least. But 2 of them can be life-threatening if they're missed. Before we look at the rest of the symptoms, if you feel like you're benefiting from the video and the content we provide, please go ahead and like it, and don't forget to subscribe to the channel and leave us a comment below the video about which symptoms you experience most during a hemodialysis session, and I'll reply to you personally. Let's continue. Symptom number 4 is chest pain or chest tightness during the dialysis session. Let me be clear with you. With this symptom, we have to stop everything. Dialysis patients naturally have a high risk for cardiovascular issues, and heart disease in America is the leading cause of death for dialysis patients, not kidney failure itself. Dialysis itself puts pressure on the heart due to changes in fluids, salts, and pressure during the dialysis session. So what might you feel? 1. Heavy pressure on the chest, as if something heavy is placed there. The patient says that something's pressing on my chest, a squeezing or gripping sensation that comes and goes. And if you're a diabetic and have this feeling in the epigastric area, that's a very dangerous symptom. Burning in the middle of the chest and a dull pain that radiates from the chest to the left shoulder. If any of these happen, stop talking immediately. Call the nurse quickly and tell her this exact phrase: I have chest pain. Don't say you feel weird or a bit uncomfortable. Say, I have chest pain. This phrase alone will make the medical team move fast. And that's exactly what should happen. Don't downplay the situation, and don't wait for the pain to go away. You're connected to a machine that makes your heart work harder than usual. Your heart is working hard, so you must respect that. Symptom number 5, nausea. It's the second most common symptom during a hemodialysis session. Most patients think this is just a normal part of the dialysis session. Mild nausea, yes, can happen, especially during the first few sessions. But you must understand the difference. There are things many people don't know. Nausea that comes with any of the other symptoms we've discussed isn't just simple nausea. Your body is sending multiple warning signals at the same time. Nausea with dizziness, possible drop in blood pressure, nausea with chest tightness, possible heart issue, nausea with sudden shivering, possible infection entering through the fistula or the catheter. If you feel nauseous enough that you might vomit, tell the nurse before it happens, not after. She can adjust your body position, slow down the machining, or give you anti-nausea medication under medical supervision. And if you actually vomit, the session must be stopped. The nurse needs to know how your body reacted, even a single episode of vomiting. During a hemodialysis session must be recorded and reviewed by the medical team, checking your blood pressure and fistula. This is essential. Symptom number 6, sudden dizziness and a feeling of true vertigo. And I don't mean just regular fatigue here, or just feeling a bit off. I'm talking about real dizziness, or a sensation that the room is spinning during dialysis, to the point where you feel like you might fall even while sitting. This happens more often with patients taking certain blood pressure medications, because the medication, combined with fluid removal during dialysis, can sometimes work more powerfully than intended. A patient might start with a blood pressure of 160/100 and leave at 90/50. This drop makes them feel like the ground itself is moving. The danger isn't just the dizziness itself, it's what happens next. A patient feeling dizzy who stands up quickly after the session ends might fall. And that fall could, God forbid, cause fractures. Dialysis patients' bones are often fragile, especially for those with a fistula or on blood thinners. This kind of fall can be very dangerous. That's why, if you feel dizziness increasing during the session, don't wait until you're disconnected from the machine. Inform the nurse. She can reduce the rate of fluid removal or have you lie down for a longer period. Plus, she can prevent the fall from happening in the first place. Symptom number 7, sudden shivering or fever. The last symptom on our list, which most patients unfortunately don't realize is very serious, is strong, sudden shivering during the dialysis session. It's not just feeling cold. It's shivering your body can't endure or control, especially if it's accompanied by a feeling of heat radiating from your body or facial flushing. And these are the classic signs of what we call a pyrogenic reaction. What does that mean? It's an immune response caused by something entering the bloodstream, either through the catheter or the fistula. This is one of those symptoms that can escalate quickly if bacteria enter through the catheter or the fistula. If not properly cared for, it can cause a very serious reaction in the body within 5 minutes, and the window for intervention here is quite short. But at the same time, when the medical team catches this problem early, they can handle it quite easily. With the right medications for the microbe, some antibiotics, and treatments tailored to your condition, you're not expected to diagnose the condition yourself. What you need to do is report it. Just say, "My body is shivering and I feel hot," and that's more than enough. The medical team will take it from there. Just report it. I want to give you something really practical to take away from this video. I call it the 5-second rule. The moment you feel anything strange during your hemodialysis session, within 5 seconds, raise your hand, press the nurse call button, or look at the nurse and speak up. Don't wait to see if the feeling goes away or not. Or think, "I don't want to bother the staff and be an annoying patient." There's something you must understand. Dialysis nurses and the medical staff are trained for this exact moment. They aren't annoyed with you for reporting it. On the contrary, they're waiting for you to tell them what symptoms you're feeling, when they started, and how severe they are. This is vital medical information, and the dialysis machine alone can't know these things. You are the medical team's most important monitoring tool, and the patients who live better on dialysis for long periods are the ones who speak up, the ones who ask questions, and the ones who report early, building a true partnership with their medical team. And this partnership starts with the 5-second rule. I want to conclude with something very important. Dialysis is a great and effective treatment that does the work your kidneys can no longer do. And there are hundreds of thousands in America and around the world living full, active lives on dialysis for many years. The goal of LifeSent today isn't to scare you. Its goal is to make you stronger while you're in that dialysis chair. Knowing these 7 symptoms doesn't mean any of them will definitely happen. It means if something starts to change, you'll know what it is. You'll know what to tell the staff and how to act at the right time. James, the patient I told you about at the beginning, told me a while ago, "I just didn't know. If I had known, I would have spoken up immediately." Now, you know too, just like James. If this video helped you, send it to any dialysis patient you know in your family, or a friend who's just starting hemodialysis sessions. This information shouldn't be hard to access. And if you want to dive deeper, we have a full video on fistula care that every dialysis patient should watch. You'll find it right here. And remember, we made this video for you today with the best of intentions. We hope you've also done something good today. Always make it a habit, like, share, and help others. I'll see you next week to check in on you and give you peace of mind. Stay safe.